Hello and welcome to the Functionally Enlightened podcast with Dr. Sharon Sarita. We interview well-respected medical and functional practitioners, as well as patients who have overcome disabling chronic conditions, such as dysautonomia, and reclaimed their health. These enlightened guests provide helpful tips on managing chronic pain and illnesses, using a combination of traditional and whole-body healing modalities. If you're interested in natural healing and quality of life improvement, you're in the right place. Thank you for listening to today's episode.
Hello, everyone. Today's special guest is Dr. Lonnie Herman. Dr. Herman's life mission is restoring hope to people who were told there was no hope by using a very precise, scientifically based method to uncover the root cause of any disease and rapidly eradicate that cause through personalized protocols that are uniquely designed for every person. Thousands of his patients suffering from debilitating and chronic illnesses have fully recovered their optimal health. Their success is the reason he is so invested in the cause. His scientific pursuits and vast postgraduate studies included a deep dive into neurodegenerative and autoimmune diseases, as well as diseases that seem to have genetic origins. Thank you so much, Dr. Lonnie Herman, for joining us today. We're looking forward to having this discussion with you on the various chronic illnesses that you have been treating in your practice. So what I'd like to start off with is to get some information from you on what drew you to the field of medicine that you're in currently.
Well, first of all, thank you very much for having me on this show with you and to get my message out to all the people who listen to you, as well as you with your chronic illness that I've become a little bit familiar with. I'll tell you, when I was very young, there was no direction for me of become, what type of professional to become or what to do in life until I was about 15 years old. And I was always into physical fitness. But when I was 15, my mother had a discussion with me. She just sat me down one day and said, you got to pick something after high school. It's time to go off to college and you have a choice. Become a doctor, a dentist, or a lawyer. Which one do you want? And that was pretty much it. And so at that time, right around that time, my older brother, we were very into bodybuilding, weightlifting, and he injured his back one time lifting some weights, and it turned out he herniated a disc in his lower back, and he could barely even stand up. I still very vivid in my mind right now is the excruciating look he had on his face when he would try to stand. It was just extreme pain. And so back when we were kids and we went to a summer school, we became friends with a few kids that we grew up with, and one of them, it turned out her father was a chiropractor, and he helped my brother be able to get out of back pain and walk again, no surgery, no injections. And we called him doctor. And that was basically why I chose chiropractic. I just thought it would be something that would be probably easier for me to learn because I was already into physical fitness. That was my impression. But when I came out of chiropractic school, I'll tell you, I learned pretty quickly that it wasn't the everything for me because I noticed that there were people around me, family members, friends of the family, who started developing certain serious health conditions. Whether it was having a heart attack or somebody had Parkinson's, or another person had ovarian cancer. Then I noticed people around me with fibromyalgia and some other symptoms, diabetes. And I was more curious of how to help people with real serious ailments. And chiropractic itself, for me, turned out to not be the ultimate, be-all, end-all type of everybody needs it because it's going to fix the symptom, stop the heart disease or stop the cancer or stop the, let's say, like fibromyalgia or somebody who had a rapid heart rate problem that wouldn't calm down. It turned out to be not really the most effective treatment for that. So I went back to school and I was exposed to a deeper understanding of the central nervous system, neurochemistry part of it, like serotonin, dopamine, and other chemicals. And I started to see about immunology. I really began to just realize and became thirsty for so much more information about what to do for people to get them better. And I'll go back in time. When I first came out of chiropractic school, my grandmother's second husband, my first grandfather, he died shortly after he had a very severe stroke. I only got to know him for coherent as a kid. I mean, he had a stroke when I was 5. So I really remember him for like 5 years until he passed away. But the whole time I remember, all my memories are him with a stroke of not being able to talk and move his arm and leg. But when she got remarried, my grandmother, on my mother's side, she got remarried and he was a wonderful man. They had 15 good years, great years of marriage. And then he developed Parkinson's. And so when I came out of chiropractic school, I remember standing in their kitchen for dinner one night and I noticed these pill bottles on the counter. And I asked him, what were these for? And he said he was scared. He was diagnosed with Parkinson's and he was frightened. And a year and a half later, he died. He just withered away and died. And he had some really supposedly top-notch neurologists and hospitals and the right drugs, pharmaceuticals that were on the market. And I wondered, I was actually pretty pissed because while people in the community with chiropractic, they kind of looked at it like that was the, not a real doctor. And they were looking at chiropractic as if it was like, just only the select few, 10% or less of the population who would go see a chiropractor. But here was this wonderful man who I knew, I got to grow and love for many years. And he was under who was supposed to be the care of the really right doctors, with the really smart ones, with the right testing and the right methods of treatment. And here, a year and a half after he was diagnosed, he died. He withered away, lost his way, couldn't walk, couldn't talk, couldn't wipe himself, couldn't feed himself, couldn't dress himself, couldn't clean himself. He couldn't do anything. My grandmother took care of him. She loved him. She had to do everything. Not that she chose to. She loved this man, but it was just she had to really take care of him. And he couldn't do anything for himself anymore with the medications that they gave him and the testing and so on. So it left me with a feeling of almost an anger towards that community, talking about the medical side of things.
Right.
But also it taught me something, because he said, we had a conversation one time, because I tried to treat him with chiropractic and it made no improvement and made no reduction in his Parkinson's condition. And we had a conversation one afternoon, and I didn't understand it until a few years later. He asked me, because I said, you got to just stick with chiropractic. You should just keep coming in. And I was fresh out of school, basically, right? So he said, why do you have to be so idealistic? And I didn't understand that. Now I do, because my ideals were that it was the right thing when I learned in school, yet it didn't work for him. But also medicine didn't work for him, right? Physical therapy didn't work for him. None of it worked. So it left me with a strong desire to really try to figure it out, because I was, at least in chiropractic school, there was a cause for all disease was the idea. So it left me with that opening in my mind of saying, I've got to figure it out. And so that experience with him was one of the main reasons that there's another one, but one of the main reasons why I just have this unquenchable desire to figure it out and help fix a person and get them better from their chronic disease. My wife, we're married for close to 20 years, but she had endometriosis, and the pain that she suffered was horrendous. And before I even went back to school, this was going on. And she had multiple different gynecological visits and different medicines that did nothing for her. Then they said, you need surgery. And so we go to an outpatient surgery procedure. I drop off at the hospital, pick her up a few hours later. And she wasn't doing good for a couple of days after the surgery. And now I understand why. But it was maybe a little more than 2 months after the surgery. The pain came back like it never left, like it never did a surgery. She goes back to the gynecologist who did the surgery. And he said, oh, you're just one of the women who just had to learn to live with it.
No.
What was that? Right? Nonsense. So a $21,000 procedure. And here we were with the same problem that we went to him for. So it didn't make sense. And now she doesn't have that pain anymore because we figured it out. But that was one of the other pivotal points in my life to get me to really get back in school and get to figure this out, because I couldn't watch her suffer,
right,
which made me suffer, right? So
anytime somebody close to you is suffering from this, we work harder to figure it out. It's one thing for us to be ill, but when our loved ones are ill and we feel helpless, it seems that's our driving factor.
Yeah, I'll agree with that.
With the surgery, sometimes our physicians and our surgeons will put the fear in us that the surgery is going to be the only way to get improvement. When you experienced this with your wife, were you in that mindset that there was nothing further you could do, or did you immediately jump to, okay, we are going to figure this out and start with diagnostic protocols or whatever your methodologies are?
I truly didn't understand it. I saw her pain, but I didn't get it. I mean, going back to school, it wasn't like the information was just given to me right away. Looking through websites, looking through videos, it was all the same information I was seeing online. So I didn't really have that. It wasn't just like I could get that information right away. But when I started going back to school, that was part of the pivotal moment when I decided to go back to school, because I did have to figure it out. But I remember just asking questions in classes and in blood chemistry classes and endocrinology classes and other courses I was taking. And they just had physicians who were teaching these courses. They had no idea. The supplement companies that I tried to, learn from as well, because they had courses as well. I was just asking and emailing, and there was no answers. They didn't know. It took a very long time to figure it out. it wasn't just, we're going to tackle this right away. No, I was already thinking, I've got to get back to school because the Parkinson's happened, right? That situation with my grandmother's second husband. There were other things as well. In my chiropractic clinic, we're talking over 20 years ago, there were people who were fibromyalgia not getting better, people with depression not getting better, anxiety not getting better, people with foot pain not getting better, neck pain not getting better, somebody who had asthma as not the reason why they came to me, but that didn't go away. Like I was taught in chiropractic school, it could go away. So there were a lot of different reasons why I was starting to consider to go back to school, but she was definitely one of them. It was one of the other key points.
Mm-hmm. Some of the stuff that you were learning from the academy, did you keep them with you in your practice, or did you branch off to address these chronic conditions that you came across, like the fibromyalgia? And I know that you do treat patients with dysautonomia, with lupus and MS. So I wonder if you were able to pick up that from the academic world, or is it something that you had to continue to teach yourself as you went along?
Both. Very good question. Both. Understanding chiropractic school gave me a good insight into the body, not greatest, but definitely good insight. Yet when I started going back to the functional neurology schooling and human brain dissection and blood chemistry analysis and endocrinology and neurochemistry and immunology and developmental disorders of the brain, I was also right around that time when I thought I was getting so much information and I was really getting to be smarter about the body and what to do for people and running different laboratories on people and the whole functional medicine arena that I was involved in. There was a friend's mother who I knew very well for many years. She got cancer and the treatments that they offered her did no good. And I didn't know what to do at the time because that was like, what is that? Because I was learning about dysautonomia and I was learning about movement disorders like Parkinson's and ways to assess and ways to hopefully treat effectively. But once the cancer appeared around me, then I was stumped again, not realizing what to do. And so that experience, watching that happen with her, I decided to go back to school for that as well, for alternative cancer treatments. I shouldn't say cancer treatment. Let's just say looking at the body in a different way to help the person rid the potential causes of why the cancer developed so the body can help to heal itself is the idea.
I love that.
And that expands into everything else that I'm doing now. So that gave me a bit more of a better viewpoint. So it all really, part of it is, as you just said, from learning from the schools that I've attended and the courses I took and different physicians. I met with different physicians from across this United States who were doing their own, as they said, their own kind of method. And so I paid people a lot of money to be able to go and visit their clinic and learn from them. And once I really gained enough from the world in dentistry I got very involved with and the cancer world and so on, I really did, as you just said, I started to realize all the parts of my studies that I didn't really, and the treatment types of or protocols that were taught to me that I didn't really need to use yet to help a person, but I was able to take pieces of each part of the journey. And now if we can say sort of like an intuition, if we can go with that statement of just being able to understand the human body and putting many pieces together to create the method that I use now. So there's a lot of credit I can give to many mentors over the years, yet it's also, and I'll tell you, my wife behind me, she's a great driving force as well. And she's with me literally hands-on every day in the clinic doing this work with patients. There's sort of like an intuition that comes with this type of attention I give to working with patients. So it's just putting all the mentors, all the studies and my own type of insight into what we're doing now. And what we're able to do for people is just incredible. It's just incredible.
You have such a vast amount of education. I'm assuming all of your patients, you approach them with the bio-individual approach. Does it get to be a challenge in treating so many different conditions? Is it challenge to create those protocols for each person and to follow up with them, making sure they stay in compliance to get that improvement that you want them to see?
Yeah, well, it's what I want and what they want, hopefully, and what their family wants for them, right? So there are some people, no matter how many calls that we can make to them, they're going to be their own person, right? So there are some people who have come to my clinic and we do this intensive workup on them and create a customized protocol for them that should get them to some degree, some improvement or a lot of improvement, reduction in their symptoms and get their function back in their life, back to a better level. And there are still some people who just look at it and say, you know what, they'll put it aside. And it's very few and far between, but it has happened that we can coach somebody along and they still won't do it. And that's their own decision. But for the majority of people, it's a very intense workup for people. And we are constantly improving through constant observation and constant with a follow-up with the patient to be able to understand what worked, how can it be better? Because my goal, and the patient's goal, of course, but my goal is to get a person better as rapidly as possible. When we can see a person who's got a crippling condition, like a dysautonomia, for example, where they have, they stand up and their legs just give out, or their heart rate just doubles, right? From, let's say they were sitting down, it was like 60 beats a minute, and then it goes up to 120 or 150 or 160 just by standing up, and it stays there. Or they feel dizzy, they feel faint. Shortness of breath, like literally can't even stand up for even a second, we've seen here. I'm not exaggerating with that, because the crushing pain on the chest, they couldn't even breathe at all, and barely breathing sitting down or lying down. It's getting the person better as fast as possible, because there's nothing more rewarding for us, including the patient, but nothing more rewarding for me than seeing the person get their life back. It's amazing. It's such an amazing feeling. And to know when I go home and I look in the mirror, I know I'm doing the right thing for a human being, right? So I'm constantly observing what's going on with the person. I'm constantly thinking of how can I improve my skill set to be able to get that person better faster. For me, that's what it's all about. I don't know if I went off on a tangent there to remember exactly what your question was. But,
No, that's perfect. And you brought up dysautonomia, which is one of the conditions I struggle with. Puts things into perspective for me, though, because I am able to stand for at least a few minutes before I need to find a seat. I experience the pre-syncope pretty rapidly. And other than that, the fatigue, the nausea, those are things that I struggle with daily. So I can imagine that it's probably 10 or 100 times worse for the patients that you just described. The illnesses that fall under dysautonomia, we have POTS, orthostatic intolerance. Do you see a lot of patients with that condition?
We've seen positive results with that. And then there are more severe cases. So let me just say that there is one that was extremely severe. And the point I try to express to people when I meet with them is, I can have two people who come into my clinic, same age group, same gender, same race, same, let's just say religion, same part of the country that they came from or part of the world that they came from. And yet they have and same symptoms are very similar in their symptoms they're sharing with me here, and the same diagnosis even. All right. So like two POTS patients, yet they have totally different puzzles that we have to solve to get them the relief from their condition. So I always tell people that they've got to understand that there's a number of different reasons from one person to another. And one person may respond a lot faster than another, because what if there's like an analogy, if you have a rowboat and there's 20 holes in the bottom of the rowboat, you have another rowboat with 10 holes in the bottom of the rowboat, they're both going to sink. Water's coming in the holes. You plug up 10 holes in the rowboat with the 10 holes that are only 10 holes in there, that's going to, no more water comes in. But if you plug in the 10 holes and there's 20 holes, you still have 10 holes of right where water's coming in. It's going to sink slower, but it's still going to sink. So the point I'm making is, for each person, the disease, the cause of the disease, the cause of, in this case, dysautonomia, you can have one person who never was put to sleep for a surgery, and the other one had tonsils taken out, right, where they used chemicals to put the person to sleep. Well, those chemicals they used to put the person to sleep stay in the brain and stay in the kidneys and stay in the lymph and stay in maybe the liver and the bone marrow even, and it weakens the individual's ability to function. So the person who was never put to sleep for a procedure, they don't have those surgical chemicals, right? Unless the child was born by a mother who did get put to sleep at some point in her life, where some of that chemical did get into the child who was born through that mother's body. But the point is, when certain procedures are done, for example, like a surgical procedure, like even a dental procedure, the chemicals they inject your mouth with to numb a tooth and pull a tooth or drill it into a tooth or whatever, those chemicals seep into the tissues, right? So you can have two people, same gender, same race, same religion, from same part of the world or same part of the country, and they have the same symptoms, yet one was vaccinated, one wasn't vaccinated. One had surgery, the other one didn't. One had dental work, the other one didn't, right? So those are some things that we have to find in people. But also, there are different kinds of infections, right, that exist in people. So it takes over the body, and people can recover very rapidly. But again, my goal is the sooner that somebody gets better, the better. It's just a fascinating thing to see when people recover from these terrible illnesses. It's amazing.
So the environmental toxicants play a major role. It's not just the stressors the physical stressors, though. What about the emotional and the traumas that people experience? Do you have patients come to you with no obvious physical stressors? Maybe there's environmental stressors, air quality, maybe water quality and things like that. But
Absolutely.
do you see patients that come to you more from a mental or emotional perspective and the illness is very similar?
Yes. It's just rare, though, I'll say, in today's world where the environment, in the sense of toxins from the environment, are not playing a role in somebody's life. Can a person, which we've seen here, where it's not that they're getting poisoned from the water, like saying Flint, Michigan, and lead in the water, right? It was supposed to be very high. I'm not doubting that information. I'm just saying that that's something that people are familiar with from the news of Flint, Michigan, lead in the water. But there are people I met from another part of the country by New Mexico, where they have a nuclear system over there, and there's literally nuclear chemicals in the water that's poisoning people. So, but when we get to the emotion, there can be the emotion that will trigger the change in the function of the cell and make the person develop a symptom. Yet in that cell, what was triggered was maybe mercury was in there, or lead was in the cell, or a virus was triggered by that emotion. We've had young adults, or even older adults in their 50s come in here, and 50 is not old, right? But I'm just saying older than a child, where they've come in where they were literally molested as a kid, or they were beaten as a kid by their parent, and they grow up with a low self-esteem. They grow up with a very negative viewpoint on many parts of society. They have very bad memories, and they don't love themselves. They don't like themselves. They don't appreciate themselves. They don't think that they could amount to much in this world. And through my emotional exam process, what I realized, because I took psychology, I took some psychiatry, just psychiatry that was offered to me in school was just to become familiar with disease, different emotional disorders, let's say, and the drugs that people are on, that they're prescribed. I understood a lot about the brain through my studies. And when I realized, though, a way to assess the person when it came to the emotion and help the person to relieve those negative emotions and literally get them, even still, as you just said, out of pain, because there are people who, let's say, a physical abuse where they weren't, or verbal abuse. Let's not go with physical, but verbal abuse. And they could grow up with just, the beating down on the brain of that person and their spirit and their personality about that there was a mother or a father or whoever, or a husband, a wife, or, a brother or sister, somebody who was emotionally abusing the person. That negativity is imprinted into the cells in the human body. That negativity will, from an epigenetics standpoint, that negative emotion will trigger dormant viruses or dormant bugs that are in the person's tissues. And those dormant bugs or viruses, like bugs, bacteria, let's say, they turn on and they start to harm the part of the brain or harm the organ where they're located. So that can lead to blood pressure problems. That can lead to heart rate problems. That can lead to imbalance or vertigo type of problems, or dizziness type of problems. That can lead to headaches. That can lead to fatigue, chronic fatigue. That can lead to neuropathy, nerve pains in the body. That can lead to digestive problems that somebody's suffering from, respiratory problems. So because the germs that are part of our microbiome and our virome, they can become triggered to now, just turn on a series of symptoms to develop in that person. But they were triggered, those bugs in the body were triggered by that negative emotion. And what I've also found is even with that, the different toxins that are in the human body, like lead, mercury, arsenic, and pesticides, and there's others, without chlorine, fluoride, there are different toxins that are in our tissues that can also, as the body's it's really trying to detox itself. It has a lymph system, it has a colon, it's got sweat glands, it's got a liver, right? It's got lungs. The body is trying to detox itself. Kidneys. What happens when the body is trying to move around these toxins that are deep inside, but those toxins are actually moved from, let's say, one part of the brain to another. And now when that toxin moves from one part of the brain to another, it'll make that part of the brain really stressed and make a person develop a negative emotion. Like maybe they were happy, but then all of a sudden they become depressed. It's like they have nothing to be depressed about or nothing to be anxious about, but all of a sudden they became anxious or depressed. And it can happen from other various, what I'll say now, environmental stressors that will cause, as the body's trying to handle that environmental stress, the body is going to try its own detox strategy, let's say trying to pull some mercury out of the brain on its own. But that mercury moves from one part of the brain to another and gets stuck there, and it makes a person now have anxiety. That can happen. So for me personally, I've got to look at it professionally as well. I've got to look at it from multiple different angles all the time with every single patient. Mm-hmm. Every patient's own condition it's always a complex situation. And I want, as I said a few minutes ago, I want the person to get better as fast as possible. Again, it's a great accomplishment when we can do that. It's a great thrill to see the person come in when they get their life back, finally. And even some kids, I'll tell you what we've seen here also with children. I'm not even 2 years old with syncope, right? Where they're just constantly fainting from the time that they were born. I saw them at 2 years old. One woman brought her daughter here from, I think she lived in Washington State. And her daughter, for the first 2 years of her life, she was 2 when she brought her here. The daughter, it was almost like she had no brain. The eyes were just dazed and confused looking. There was no understanding of her surroundings. She would try to sit her daughter up. The daughter would just fall over. At 2 years old, she should be able to have a strong enough core to stay seated. She couldn't sit up. She wasn't crawling. She had to give her CPR 10 times a day, the mother told me, because she had syncope constantly, this little girl. When the daughter was inside the mother's body during the pregnancy, the mother told me that I asked her these for a specific reason, because she had a C-section. When the baby was in her baby was in her, there was no problem with the baby. The doctor said everything is coming along fine. But once she gave birth, that's when the problem started. How would that happen? But they gave her an epidural. And the epidural went from the mother's spine through the umbilical cord into the baby's brain. How do I know? Because when I treated this girl, that's what I found and developed a protocol for her. The mother came back to me for the second visit, the follow-up visit. The girl was speaking some words now for the first time in 2 years, speaking words. She was able to sit up on her own. She was able to crawl around. She was able to look at me and understand that there's somebody in front of her and she can interact with me. There was no more syncope. The syncope stopped. And one of the main reasons was she had the epidural in her brain, the little girl.
And that's not something that the mothers are warned about, because in your head, you're thinking, the worst that can happen is paralysis to myself. But you don't think that it's something that can be carried in utero and that quickly.
So that's it. And it wasn't even a vaccine, right? So people in the vaccine world of saying vaccines cause all injuries to children. I'm not saying they don't. I'm not saying they do. All I'm saying is that it doesn't have to be that. Right, a child doesn't even have to get vaccinated and can have learning disorders or developmental disorders or have syncope or have POTS because of that one trigger, that one being the epidural. There's another mother who became a patient here. She brought her daughter here. Her daughter had several symptoms. She's now better. Then the mother decided to have her husband come. He had various brain problems, went from being like genius level to not being able to think clearly and couldn't remember anything and couldn't even keep a job. Now he's better, and I have video of him, and he's just awesome and wrote a couple of great reviews online about us. But also the mother became a patient. The reason why I'm talking about this family is because she had fibromyalgia so it was diagnosed for 15 years. And one of the symptoms out of many, was intense back pain, constant back pain for 15 years. And what I found in her, because it was like in the first week or so of her first protocol that we designed for her, the first or second day remedy was to get the epidural out of her kidneys. I found the epidural was in her kidneys for all these years. Now I say all these years, she had back pain for 15 years. It was right after her children were born. So epidural, okay. Epidural was in the kidney. She took the remedy, and a couple of days later, all the back pain she had for 15 years stopped. Just appeared like it never existed. There's other symptoms. Fatigue was gone, and other symptoms are gone. And I have her great testimonial video up online. But yeah, I'm relating that to you personally, where an epidural used on you, or even the surgical chemicals to do a certain procedure where they put you to sleep, those chemicals can exist. And just like any of your listeners who have a dysautonomia or know somebody who has a dysautonomia, these anesthesia chemicals don't just leave the body, no matter what the surgeons or the anesthesiologists or the dentists say. I'm not blaming them. If they got to do a surgery, you need to be put to sleep. They're not going to cut you open or pull a tooth without numbing you or putting you to sleep, right? So it's got to be done. It's just to understand that these chemicals stay in the body. They're absorbed into the lymph. And what if the lymph is not strong enough to detox it out of the body? They get into the kidneys. And what if the kidneys are already overwhelmed with many other toxins and infections, and the kidneys can't flush out these these chemicals, these surgical chemicals. And just like how a tattoo ink goes into the skin and it stays there in the skin, well, it might fade over the weeks or years that you have the tattoo ink in the skin, but the tattoo ink never totally leaves the skin unless you do a procedure to get the tattoo ink out of the skin. The point that I'm making is when they use these chemicals to put you to sleep for a procedure, those sedatives and anesthesia chemical that knocked you out and fentanyl and whatever else they used to put you under and keep you under, those chemicals, like a tattoo ink, they get absorbed into the brain or your cerebellum or your brainstem or your liver or your kidneys. They stay there. And when the body can't flush them, the body will instantly start to experience malfunctions, as you're calling symptoms, right? So when we can find these chemicals and help to get them out of the body from the brain, from the kidney and so on, very safe and very effective strategy, and provide the right safe and effective remedy to get it out of there, the body just bounces back. It just bounces back because you're getting rid of the shackle that was holding the organ down. Does that make sense?
It absolutely does. And that brings me to a couple of questions. I don't want to take up too much of your time, but I want to follow up on that. People like myself and patients that come to see you, they are extremely debilitated. So not only surgical procedures with all these toxins, but you think about all the diagnostics done too, the imaging, like MRIs with contrast, all those things are also accumulating, which goes to the brain. Those are not things that are said to the layperson. Like we go in blindly thinking, okay, this is the best plan of action. When we come to doctors such as yourself, first off, we've been gaslit by many other specialists. And so we have a hesitation. How would you go about getting somebody comfortable to see you and to listen to your protocols? And do you have a standard group of labs that you like to run on these patients? Or is it completely bio-individual?
There's a few points there I want to make. One is, I think an educated patient is the best patient. Something else that helps to help a person understand this information a bit easier. One reason is that whatever methods have been done to them or supposedly, quote unquote, for them to try to get them better that don't work, people who come to me, most often it's people who are at their, as they say, at the end of the rope. Right? They're at the end. They've tried it all except for this. With that mindset that they're in, with the struggle that they have every day in their life, most often people are a bit more open-minded to that. They've got to think outside the box, so to speak. Furthermore, I put a lot of educational material online. I've got a lot of social proof through video testimonials, through people who, like other very ill people with POTS, with asthma, with heart disease, with skin rashes, with migraines, with you name it, but with arthritic pains, no more. I put so many different anxiety, depression gone from my work. So I put a lot of different videos up of real life patients who I don't pay them for their testimonial. Okay. So first of all, but they're putting up they're happy to share with me. There are some people who are shy at the camera and won't get on with me. So I should have a lot more, except for the shy people have not gone on camera with me. But we have a lot of different patient testimonials that help to begin to break down the barrier that people keep up in front of them that would stop them from coming in here. They've already been led down a path by many different physicians where they have gotten zero improvement. So there's education, there's social proof that we use of people who've gotten better before. And then we have a caring person who's on the phone who can help somebody to answer a few more questions that they may have when they're calling here. So I think that's the first part, is to do my best to show people proof and give them and lend them an ear to be able to hear. A lot of people, when they fill out paperwork for me, they write me information before they even get in their first pre-examination diagnostic consultation, we'll call it, their pre-exam diagnostic consultation. One of the common things that people write down who've been sick for a very long time, they say, I just want a doctor who can understand me. I just want a doctor who's going to listen to me and just understand what's going on with me, right? So that doesn't mean that they're going to talk to me for 10 hours and cry to me about everything in their life. I'm saying that most doctors who people go to, it's a very quick visit in and out. Now, I'm not saying every physician, but Most doctors who are the people I talk to, they've had quick visits in and out, and it's like the doctor didn't even hear what I had to say. They don't even understand. They don't even believe I'm feeling this way because they can't see it in their laboratory. They can't see it in the MRI or the whatever scan is done, and they don't even see it with a physical examination that the patient has a problem, except for the patient telling them what they're feeling. Right. So some people don't wear the symptoms that they're telling the physician that they have. So to that point, I've got to be able to listen to them, but I've also got to be able to ask specific questions in that consultation appointment, specific and different questions to help me sort to put the pieces together for them. So as they're describing their condition and I start to offer my viewpoint on it, the majority of the people feel like maybe I am the person who can, it starts to get them over that little hurdle of, can somebody really do it? Is this Dr. Herman really the one for me? Because nobody else has helped them before. That's it. So I think that's it. The education, my confidence, and that's another thing I hear from people, that they're just, the way that I've expressed myself, I'm so confident in helping them understand that there is a way out of their disease. And then when they finally let their guard down and they come in here for their first exam, once they understand the process, which would take me a long time to explain, when I'm able to show a person exactly different environmental stimuli that are making them weak, different functions with their body that are triggering their symptoms, then it becomes much more of an eye-opening experience for them. And then when I report to them at the end of their exam what I found with them, and in very specific details, like Epstein-Barr virus on the thyroid, and there was the epidural was in their left kidney, and there was mold in their right kidney, and there was parasites and Epstein-Barr virus and influenza virus and measles virus in their stomach. Like when I'm talking like that, then it's very different from what they've ever heard before. And again, there are people who still, even after they get the protocol sent to them, and even after I give them all this incredible amount of attention. I mean, an average visit in here for a first exam patient, it could take me 5 or 6 hours appointment with the person. This is not a churn and burn type of clinic at all. I got to spend time with the person. I got to be able to begin to really understand what is driving their condition. So again, that experience for a person helps them to really appreciate our efforts more, and then they've got to go through the protocol. But that in and of itself is not enough, right? So then I've got to provide, and I will tell you, an outstanding type of exam that they've never experienced before, ever. So, because I created all these steps that I'm doing. So I know they've never experienced it before.
Yeah, I love that you make that clinical correlation key. Like it's not yet you're treating the paper and you're not just treating the symptoms. You're actually spending the time with the patient. That to me would be a big comfort. I didn't find that until I left traditional medicine practitioners and started looking for functional practitioners. So that's key. And I really love how you take that deep dive with the patient and you have pre-exam consultation.
Consultation, yes.
Yeah. So we were talking about standard labs that you might run. Do you have any standard diagnostic testing that you do with all patients, or is it more of a customized thing?
Well, first of all, everything's customized. Okay. So standard is the type of exam I got to do on the person. So first point is my type of exam that I've created is what I have to do for every patient, period. Because we've got to find the true triggers for the symptoms, and we've got to find the causes of those symptoms that are related to the trigger. Meaning, if somebody broke out in a rash and hives from eating chocolate, I have to find what is it about the chocolate and what's in that body of that person that makes them break out in the hives from the chocolate. So there's a certain way that I do that in my exam process that you're not going to find in a food lab, right? So they could tell you in a food lab, you got a reaction to chocolate, don't eat chocolate. And that's what the practitioner will say, and take out gluten and take out dairy. But they're not going to find what it is in you that's making you have the reaction to the chocolate. They'll just say, stay away from that food. And you say, well, how long? I like chocolate. I want to eat it. Well, you can't for the rest of your life, basically, is the story that they give you. So from the functional medicine standpoint, when I ran all the different labs of adrenal testing and extensive blood testing and antibody testing and leaky gut testing and food sensitivity testing and expanded hormone panels for men and women, even neurochemistry panels that turned out to be bogus. I can talk about this for hours. But the thing is, all those labs that I ran many years ago, outside of if somebody's diabetic and we have to look at their A1C and their glucose, I mean, that's an obvious. If somebody's got a thyroid hormone problem. We've got to be able to make sure that we're not just guessing at it and thinking we got it right because I think about their thyroid. I've got to be able to look at that blood test to give me a better understanding that what we're doing, not only is the person becoming less symptomatic and or zero symptoms with this work over time, or rapidly, it's also that we've got to be able to make sure that we can see it in a lab in that sense, right? So let's say somebody has multiple sclerosis. Well, looking at the person functioning better, they can move their leg now, which I've seen paralysis for 5 years with MS, and the woman can move her legs again. I have that on video, by the way. When I can see that she's able to move her legs again, and she's able to hold her bladder, no more urinary incontinence, and she has no more numbness from the neck down with MS, that the patient wants to in the future see what is, while they're functioning better, right? That's great, but are we actually seeing the change? The tissue that was diseased, is it getting healthier? So that's important. If I'm working with somebody who's got congestive heart failure, then of course we're going to run it, or have their physician run a follow-up echo. I'm going to check their blood pressure. They check their blood pressure, check their heart rate. We've got to make sure, and maybe running a monitor on the heart for a day or a week or a month to make sure there's no AFib and the heart's pumping out the way it's supposed to. It's going to pump out that a normal amount of blood to the heart, to the brain and the body. So the point is, there are certain disease conditions, patients who I'm working with these different disease conditions, where there are going to be certain labs that we've got to see. Okay. Diabetes, we got to look at that, right? So for a heart disease, of course, we want to look at certain values in the blood and in an echo or so, or an MS, you want to see the lesions and what's happening with the lesions in the brain and the spinal cord. But generally speaking, when somebody comes in, for example, with a dysautonomia POTS condition, while I can look at their blood pressure and look at their chart that they brought in of the blood pressure readings that they've taken sitting or standing or lying down, I'll point out with certain conditions, when the person starts to feel better and they see the Raynaud's go away, they know they're getting better. When the person feels that they can stand up for 10 minutes without feeling faint or without feeling the heart rate or feeling the legs get weak, when they can stand up for an hour or climb stairs, there's no laboratory that's going to tell me that they're getting better. The function is what's telling me they're getting better. But different laboratories that I ran years ago, and I talk about this in a video that's in my eBook that's free on my website, that I ran all these different labs on people, and there were too many patients with different conditions, POTS, fibromyalgia, lupus, MS, and others, where there was really nothing wrong that we could find. We couldn't find anything really out of order in these different laboratories. So that point left me with almost a sadness about that system that I believed and trusted in for a while, but also it left me with a kind of a stress, as well as a more of an urge, a yearning to find, how can I find these different things that are causing people the symptoms? So I don't need a lab to help me figure things out in many people. And looking at diabetic numbers, for example, or looking at somebody's blood pressure reading, yes, we understand what's going on of what their blood pressure is or what their blood sugars are, but it's still that type of assessment is not going to tell us why the person has a high blood pressure or why the person has a high blood sugar. It's not going to tell us why the person has a dysautonomia, right? But it's great to be able to look at a person's follow-up tests when they go back to their, let's say, cardiologist or the neurologist, and they have, for example, with a dysautonomia, they have a tilt table test, and there's no more sign of any kind of dysautonomia, right? It's just awesome. So it's great to use those as a follow-up to have now medical proof that the condition was totally reversed. In one case, a woman has cysts in her right and left breast, and I have this video up on my YouTube channel. She had multiple cysts in the right breast, multiple in the left breast. That was found with ultrasound and with mammogram. She came to me, and during the whole course of treatment, which took about a year, naturally doing what we do and providing her natural, safe, and effective treatment, the cysts totally disappeared, and we have proof in 3 follow-up over the course of the year. Every quarter, let's say, she had another mammogram and another ultrasound. And that's a lot of x-ray, I understand, but she had that done. And we saw over time that the cyst size of them and the number of them were disappearing until the final one totally disappeared, cyst-free completely. So yes, so there are certain labs or imaging studies that we can use, but it's not going to help me diagnose what to do for the person.
That's super encouraging and fantastic to hear of all the conditions you're able to properly treat despite those traditional labs that would get at in Western medicine. So even with diagnoses from from that realm, you're still able to get to the root cause and like you said, the root triggers, and be able to figure out changes that they can make to reduce that metabolic chaos or to return them to proper function. All of that is fantastic. I'm pretty sure you're located in South Florida. I lived there a few years ago. I wish I would have met you sooner. But if our listeners want to reach out to you and they want to work with you or learn more about the services that you provide, how can they reach you?
So the phone number here is 954-370-3100. 954-370-3100. That's the clinic number. The website is my name, Dr. DR for Doctor, Lonnie Herman, drlonnieherman.com. Email address is clinic@drlonnieherman.com. We have a YouTube channel, a lot of incredible videos on there. We've got a Facebook page, an Instagram page, and of course, as I just said, on my website. People just want to, when they go to my website, they can even, without even speaking to my assistant, they can just book an appointment right there on the website. It's got a calendar. It's everything can be handled right on the website without even talking to a person.
Great. We will get all of those links in the show notes and make sure to include that free ebook or information on your free ebook that discusses your methodologies. So we appreciate your time. You shared so much valuable information with us. So thank you again for taking your time out.
Thank you very much. I really appreciate you giving me the opportunity to share with you and your listeners.
Thank you for listening. We'll see you next time.
Dr. Sharon Sarita is not a medical professional and is not providing healthcare, medical, or nutritional therapy services or attempting to diagnose, treat, prevent, or cure any physical, mental, or emotional issue. The information provided in this podcast is for the informational purposes only and is not intended to substitute professional medical advice, diagnosis, or treatment. Always seek advice from your physician or other qualified healthcare provider before undertaking a new health regimen. Do not disregard medical advice or delay seeking medical advice because of information you heard in this podcast. Do not start or stop any medications without speaking to your medical or mental health provider.